Hi guys, welcome to my channel. Thank you so much for being here today. I am super excited to share this video with you guys. So this is going to be a series of video. So this is basically going to be an educational video, plus there is going to be a demonstration of what I'm going to be teaching. So super excited to share this with you guys. So this series of video is basically going to talk about nerves. It's basically going to talk about nerve flushing, gliding, and stretching. So before we go ahead and begin to talk about nerve flushing, gliding, and nerve stretching, we're going to be talking about nerve in general. So what exactly is nerve, and we're going to talk about types of nervous system and why nerve flushing, gliding, and stretching is important. So without taking this any longer, let me just go ahead and explain what nerve is. So in the most basic terms, nerves are basically dynamic structure and they need the ability to stretch and glide. So we're going to talk about types of nervous system, right? So there are two types of nervous system, central nervous system and peripheral nervous system. So it is known as CNS and PNS. So we're going to go ahead and talk a little bit more about that. So central nervous system basically consists of your brain and the spinal cord. Whereas peripheral nervous system consists of all the nerves that comes out from your brain and that comes out from your spinal cord, leading into the different parts of your body. So that was basically about nerve and types of nervous system. Now we're going to talk about why nerve stretching, gliding, and flushing is so important and why am I so passionate about it. So when I teach my class, I try to add a little bit of like nerve flushing and gliding here and there. So nerve gliding, stretching, and flushing are exercises that restores mobilization of our peripheral nerves. So when a nerve is injured, it cannot glide normally through a surrounding sheet, and which can cause a really sharp pain. So similarly to muscles, nerve can also be stretched really carefully to reduce the inflammation or compression and ultimately allow the nerve to just glide very smoothly. So nerve flushing aims to restore the normal neurodynamic and helps to resolve any associated symptoms that might be causing in your body. So nerve gliding, stretching, and flushing are exercises that helps to restore mobilization to our peripheral nervous system. So for instance, a nerve is injured, right? So when a nerve is injured, it won't be able to just glide normally through the surrounding seats, and that is what causes the pain in our nerves. Now we all know that we can stretch our muscles, right? So the same goes for our nerves as well, guys, and that seems to be really mind-boggling to a lot of people, but you can stretch your nerves. So when you're able to stretch your nerves, what it basically does, it restores mobilization and your nerves can just glide properly how it used to before that injury, before that restriction, or before that symptom, what might be going on in your body. So the whole idea of nerve flushing, gliding, or stretching is to just restore the normal neurodynamics in your body, of your nerves. So let's talk a little bit more about the peripheral nervous system. So there are 43 pairs of sensory and motor nerves that connect the spine and the brain to your entire body. That's a whole lot of nerve, guys. So guys, I want to talk a little bit more about the symptoms of peripheral nerve disorder. So the peripheral nerve disorder interrupts the message sent between the brain and the body. So the peripheral nerve disorder interrupts the message sent between the brain and then the rest of your body. So when this happens, it can result into numbness, painful cramps, muscle weakness, tingling and burning. So these are like the common symptoms that you do experience. So a very common question when I do mention about like how the message is being interrupted. So why is the message being interrupted, right? If you think about it. So the message is basically being interrupted mainly because if the nerve is being compressed or maybe it's inflamed. So those might be the possible causes. And the most common reason for that could be injury or maybe post-surgery. So those might be the common reason for that. Now this leads me to my very favorite part where I get to talk about the most common peripheral nerve that gets infected. So the series of videos that are going to come is really going to focus about two different types of nerve and the main common problem that we get because of those nerves. So one of the nerves that we're going to really talk a lot about, brachial plexus, and the other one is sciatic nerve. So some of you might have heard about brachial plexus, maybe not, but sciatic nerve, I think a lot of you have probably heard about it. So those are the two different types of nerve that we're really going to target. That being said, the very first one that we're going to talk about is brachial plexus. So the brachial plexus consists of three nerves that we're going to talk about: the median, the ulnar, and then the radial nerve. So today we're going to talk all about the medial nerve and brachial plexus. These nerves are located in your arm. So you know this work that we're going to be doing, that I'm going to be demonstrating and leading you guys through this process. It's all related to your neck, your shoulder, leading all the way to your arms. So brace yourself. We're just going to go ahead and get started. So don't forget to go ahead and subscribe and hit that like button if you don't want to miss any of the videos that I put out on YouTube. So that being said, I will see you guys in the next video, and in that video we're going to be doing nerve gliding, flushing, and stretching related to your medial nerve. Bye guys.